Hello. Thank you for joining me. This is the wrap up uh, conversation. Uh, I've wanted in this series to have a professional to professional conversation with my colleagues, other clinical psychologists, other family therapists, surrounding attachment related pathology following divorce. And I want to put aside all the other chaos and falderall and things surrounding how we assess and diagnose the pathology and just have a conversation, clinician to clinician, on the diagnosis, assessment and diagnosis of the pathology. And in closing, I want to make a personal request of you, as my professional colleagues, as professional colleagues. You may be aware I'm trying to get a standard of practice for assessment and diagnosis kind of into the zeitgeist, into the world of professional psychology, so that we establish a, a baseline of professional competence. Just baseline professional knowledge and professional competence. What we really need is a knowledge of the various component domains, the attachment system, personality pathology, intersubjectivity. That's a major component here I haven't quite unpacked yet and haven't talked about. But intersubjectivity for that shared psychological state. Family systems therapy, cross-generational coalition. Family systems therapy is huge in understanding and solving this pathology. It's going to be the way out. It's going to be the way towards a solution, is understanding the family systems pathology that nests, that holds the personality pathology and the attachment pathology within the family systems context. So I'm trying to get a baseline level of professional competence. Complex trauma as well needs to be understood. And what I'm asking, my personal request of all of you, is we don't need orders from on high. We don't need some sort of clouds to open and the universe to come in to establish professional practice, to establish standards of professional practice, to do the right thing, to do the proper assessment and to document the assessment. So what I'm asking is, just at a personal level, for all clinical psychologists, all family therapists, to start conducting an adequate intake assessment. Start collecting the appropriate information about the pathology and to document that adequate intake assessment. And that's a critical feature. Just document it. And what we're looking at is attachment-related pathology. It's caused by pathogenic parenting. We're going to do a differential diagnosis on, is it pathogenic parenting by the narcissistic borderline parent? Is it pathogenic parenting by the targeted projected parent? Which one is it? The narcissistic borderline parent, the pathogenic by them, that's the diagnostic checklist for pathogenic parenting. Just diagnose or document those three symptoms. If those three symptoms are not present, no problem, no worries. Okay, something else, go away. Thanks very much. But if those three symptoms are present, then you're looking at this particular type of attachment pathology involving narcissistic borderline parent. Pathogenic parenting, if you're looking at those three symptoms, we've got pathogenic parenting by an allied narcissistic borderline parent. Conversely, over here on the targeted rejected parent, if that parent's pathogenic parenting is causing the child's pathology, document it using parenting practices rating scale, level 1 or 2. What's going on? What is the problematic parenting we're looking at? And then just the surrounding features of it. Are we looking at empathic failure, overly strict parenting, overly neglectful parenting? What are we looking at in terms of the targeted rejected parent? So one way or the other, just document the assessment of pathogenic parenting. And we can do that. You and me, clinical psychologists, family therapy, we can just start doing that. Just start documenting the pathology. That would be appropriate professional standards of practice. You do an assessment, you document the assessment. And what I'm giving you, what these two instruments, documentation instruments, provide to you is just a really easy way to document the pathology. Check, 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 toss it in the child's record, piece of cake. Piece of cake. The other thing that I am providing to you, clinical psychologist, family therapist, is a description of the pathology and foundations that you can rely on. So you can always use the phrase, according to Dr. Childress. And when you use that phrase, according to Dr. Childress, you then get access to all of foundations, all of the research in attachment theory and personality disorder pathology, and all of that this brings together, that I bring together in foundations and ABPA. You have all of that to support you in your assessment, diagnosis, and treatment if you use the phrase, according to Dr. Childress. All the weight then falls onto me to prove it, to back it up, to back up that statement. No problem. I got it. I can absolutely do that. So I'm providing you with the ground, the foundation to stand on, to conceptually organize the information and provide the appropriate diagnosis for the pathology. And here is what I want to give at the final piece, the discussion or the conversation, the final piece of that conversation with you. Pathogenic parenting that is producing this level of psychopathology in the child warrants a DSM-5 diagnosis of child psychological abuse confirmed. You and me, clinical psychologists, family therapists, we have a duty to protect children from child abuse. You and me, clinical psychologists, family therapists, need to stand up and protect these children from the psychological abuse of their narcissistic borderline parent who is collapsing surrounding divorce. These are families. Our goal is to restore healthy family functioning. Our goal is not to blame. It's not to ostracize. It is to heal. It is to solve. So going forward, as we move into the solution, our goal is to create a healthy and functional separated family structure, of post-divorce separated family structure, where the child is able to love both parents and the child is able to receive the love of both parents. That's our goal. Fundamentally, off of the assessment though, we have a professional obligation, you and me, family therapist, psychologist, to protect the child from child abuse. The way we do that, what we do, clinical psychologists, family therapists, what we do to protect the child is to diagnose the child abuse. We formally tell people this is child abuse. That's our job. That's our role. And I'm asking you, professional psychologist to professional psychologist, family therapist to family therapist, that we all start to protect these children by identifying this form of pathology as a DSM-5 diagnosis of child psychological abuse confirmed, so that we can then take the appropriate treatment steps to resolve the child abuse, stop it, and fix the family's functioning so that we can get a healthy and functional post-divorce separated family structure. So thank you for taking the time to join me today at the patio dining room table. I appreciate it and look forward to working with you.